industrial accidents,
ancient
solving
poisoners,
crime,
poison
chemical
prevention.
spills. This is Toxic History.
Dr. Fiona Garlick Horner, who's an attending emergency medicine physician and the head of medical toxicology at Los Angeles General Medical Center, where she serves as the director of the Inpatients Toxicology Service and chair of Medication Safety Committee.
I'd like to talk today about a topic that I think is really important, especially given the current political climate, which is the use of abortifacients and the toxicity that comes from the use of abortifacients throughout history. This is a very big topic. So the goal here is not to cover everything because there is a lot here, but just to kind of focus on the salient points. I don't have any financial disclosures. I do like to kind of disclose the acknowledgement that talking about abortion and termination of pregnancy, it can be a sensitive topic emotionally and politically. So the goal that I'm trying to enact is to just speak about things in an objective way. The other kind of disclosure that I think it's appropriate to make, especially with a shortened talk, is an acknowledgement that what I'm going to present is very much a Eurocentric view of this and sort of a North American and Western medicine view, because that's a lot of what our histories draw from. But there are, of course, tons of medications and plants that have been used for millennium in other cultures that I'm not going to touch on just because the topic is way too broad. Some objectives were laid out, but the goal briefly is to talk about things that were used in ancient times to terminate pregnancies, and then the use of more medicinal products in the 18th through 20th centuries. And I'll talk about a few specific historical cases at the end that are worth reviewing. And as a general concept, it's also worth reviewing the idea of abortifacients versus amenagogues. Abortifacients, of course, are substances that are intended to terminate a pregnancy, and amenagogues are substances that were designed to induce menstruation. And of course, for the majority of human history, the border of those is very, very, very murky because of the changes in sort of political, intellectual, philosophical understanding of pregnancy and how it started and when it started, and the fact that many women didn't know they were pregnant for a long time. The idea that many of the medications or chemicals in plants for centuries that were used to in fact induce abortion were the same plants that were used to aid in childbirth because of their uterotronic properties. And I've included here a picture of Artemis, the Greek goddess of the hunt, but also of childbirth. And she represented fertility in its many forms. And I think the fact that the plant that was named after her, Artemisia vulgaris or mugwort, was used both to aid in childbirth, but then also became broadly used abortifacient, sort of illustrates sort of the dichotomy of these, especially historically, that were often used to support childbirth and support the idea of healthy fertility, which often would mean alleviating the problem of having a late menstrual cycle. So what do we know about what was used in antiquity? The very first reference to the use of drugs or medicines to cause an abortion was from the Ebers Papyrus back in 1500 BCE in the early Egyptian texts. And that mentioned a combination of plants that were used as basically an abortive pessary that were inserted vaginally, including the use of colocynth or bitter melon, which has incredible irritant properties. In ancient Egyptian texts, castor bean was also referenced numerous times with abortive properties, the knowledge that it would terminate a pregnancy. In Hippocrates' time, who wrote in his treatise on the diseases of women, several plants were mentioned. Pennyroyal, which will, of course, those on this call know that this is a theme over centuries, the use of pennyroyal, primarily in Hippocrates' time mentioned as the use of a contraception, but also parsley, wild carrot, and squirting cucumber. In De Materia Medica, from the Greek physician Dioscorides, who wrote this immense pharmacopoeia of plant-based medicines that was widely used for 1500 years before it was sort of revised and supplanted by more modern medical texts. Many plants, up to 73 different plants that were used that were known for the purposes of terminating pregnancies, including some of the ones mentioned here, Aristolochia, which is known as birthwort, causes strong uterine contractions, Astragalus cyclamen, pennyroyal again in the middle there, tansy, wild carrot, and in the bottom there is a coin depicting silphium, which grew only in the island of Cyrene, which is now in modern day Libya. And it was so important to the local economy that it was actually on the coins and was thought to be worth more than gold. In the Middle Ages, as a lot of the the understanding of pregnancy shifted and the advent of Christianity, the writings about it took a different tone. But I think it's really interesting that still a lot of the main writings about abortifacients and menstrual regulation came from religious figures. This is a depiction of Saint Hildegard of Bingen, who was a 12th century German nun, an abbess. She was one of the original polymaths in that she was an incredible composer. She was a writer. She wrote poetry, and she also was a medical practitioner and wrote numerous medical texts describing the use of various herbs and plants to treat multiple conditions, but including conditions relating to the menstrual cycle, and including the use of specifically mentioned in her text to terminate pregnancies, usually when there was a problem in childbirth or an abortion that was not completed. And she mentioned, as well as several other sort of physicians and naturalists wrote about these medications here, including, you'll see also pennyroyal on there, ergot, savin, which is a form of juniper, yew, mugwort. You'll see a couple just of note, artemisia and mugwort really started to appear in the Middle Ages, was referred to as the mother of herbs. And just like Artemisia absinthium from wormwood, it also in the Artemisia family, which contains more than 200 separate plant species. They both contain thujone, which has been shown in animal studies to have sort of uterotronic contractile properties. It also contains camphor and eucalyptal other essential oils that produce sort of a CNS toxicity when taken in excess. Pennyroyal was much more widely described for use then. This is a 13th century illuminated manuscript showing pennyroyal being used by a female medical practitioner treating a woman. As we know, and again, the point of this is not to dive deep into the chemical properties, but pelargone, which I still don't know how to pronounce, pelargone. So this is the main toxic component, which bears striking similarity to acetaminophen and is metabolized to hepatotoxins that can cause severe hepatotoxicity, as well as multi-system organ failure and hematologic complications. And ergot, in addition to its known vasoconstrictive properties and its cause of sort of St. Anthony's fire, caused pretty pronounced uterine contractions. And I found one of the things I found fascinating in researching this topic is the first midwife use of ergot in childbirth was in a stalled labor, where they prescribed 3 direct ergots, the fungal growth directly from the field. So someone ran out to a rye field, picked 3 ergots, and the woman took them in order to assist in the delivery because of its known uterine contractions. In North America, indigenous practices, there are several plants that were commonly used, including blue cohosh, black cohosh, and I also found interesting, there's an American pennyroyal that was extensively used, especially in the Southwest, by Southwest Native American tribes, which also contains pelargone. I should have figured out how to say it before this talk. And again, there are numerous, hundreds and hundreds of plants that are used throughout South America, Central America, and the southern US as well. That would be a subject for a whole additional talk. But moving towards the kind of the 18th to 20th centuries, I think it's interesting this phase when things move from sort of plant concoctions by herbalists to pharmaceutically prepared compounds and pills and patent medicines that are kind of purchased from a store in after consultation. And so the way that people acquired these really changed. One of the first references in the United States actually comes from a pamphlet that was funded and sort of circulated by Benjamin Franklin, the poor planter's physician, every man his own doctor, where they had numerous kind of medicinal cures for various ailments, including the ailment of suppression of the courses or delayed menses, in which pennyroyal water was recommended very specifically, as well as a few other compounds in order to bring about the menses. All this is, of course, written in sort of this stylized way that didn't explicitly say what it was meant, but it was very clearly intended for the sake of termination of pregnancy. This is in the kind of the 1700s. At this time, abortion wasn't highly regulated. It was considered, especially in the early weeks, not something of significant moral controversy for most folks at the time, including Benjamin Franklin. It was considered part of sort of routine medical care, although maybe not specifically talked about. Then however, as it progressed, the rest of what I'll show here is after a time when abortions were highly restricted and then fully criminalized. By 1910, fully criminalized in all states. And so much of the patent medicines were taken at a time when they were not allowed to be advertised for the purposes of termination of pregnancy. By far the most commonly referenced is pennyroyal pills, which Chichester's was the most common brand, but there were other brands that would contain pennyroyal that were worth their weight in gold. There's also like oil of pelagium, which was a little bit prior to that, which was also utilized in different like specific concoctions. The root of the cotton plant, the bark of the root had been used for a long time by enslaved people as a means of controlling their own fertility. That had been practiced for a long time in primarily the Pueblo Indians in the American Southwest, passed along to enslaved people who had very little control of any part of their lives. And so it was sort of an act of independence and rebellion to be able to control their fertility and the ability to control whether to have a child or not. Gossypium extract, or the cottonwood bark itself, was shown to have properties that uterine contractile properties that were very similar to ergot. And so this actually was marketed and prepared as in extracts and then combined into other patent medicines. Enslaved women would actually chew on the bark themselves, but then the extracts were developed and were kind of patented and sold. One of the common combinations was with cottonwood bark and ergot, both combined together, and then later added to this was apiol, which is a compound I recall not remembering or not learning anything about really as a fellow or anybody kind of as I was learning about even some with interest in plants. I never had heard of apiol before, but it was very, very commonly used as in pills that were kind of female pills or female regulating pills, and combined with ergo apiol, it was used for kind of amenorrhea, dysmenorrhea, menorrhagia, and because of its sustained tonic action on the uterus. And so this was prescribed, of course, but then became very commonly utilized for women who did not want to remain pregnant. So apiol is actually the essence of parsley. So it's derived from parsley. An older term for it was parsley camphor. And when taken in large quantities, it had significant neurotoxicity that was described. And as we head into the 1930s, we're starting to see increasing presentations of incomplete abortions from self-induction at home. And many of the things, besides physical attempts at abortion, sort of semi-surgical illegal abortions, many of the attempts that were made were by ingestion. And so this is a summary out of Toronto describing the drugs and pills and chemicals that people were used. So quinine, castor oil, ergot, cantharides is a severe irritant, lead pills, and then the patent preparations that we've talked about containing pennyroyal, and Beecham's pills, which contain various substances, including sometimes pennyroyal. And of note at this time in the 1930s, illegal abortions resulted in the death of thousands of women annually, and 1/5 of maternal mortality was thought to be related to unsafe illegal abortions, and some of those would have been these. The use of lead started to be described really in the late 1800s. This is a paper from 1905 describing the increasing use of lead as an abortifacient. And one of the things that frequently was present in homes, especially working class homes, was this compound called diachylon, which was a mixture of lead oxide, oil, and water. And it was sort of a kind of sticky ointment that would be applied to linen to make kind of a plaster. And so many homes would have this was the equivalent of a Band-Aid, really. And so many homes would have these lead-containing compounds for a topical application to cuts and bruises, and it had other sort of things that people would put on. And it was sort of discovered that as it became known that people with lead poisoning tended to have miscarriages, this became used intentionally. And women would either eat the ointment itself, or they would sort of make pills themselves and ingest the pills that they kind of derive from it. And then this became known, and then lead started to be intentionally incorporated into female pills that were purchased for the attentive terminating pregnancies at a time when termination was criminalized. This particular paper author obtained numerous pills and measured the lead content in them. Was the first time it kind of proved that intentionally lead was being put in these. This is describing 30 cases of plumism. And at the bottom of this initial paragraph of this paper, it described in rather crude terms, it would be to resemble too closely the method of obtaining roast pig by burning down the pigsty, meaning that the systemic toxicity that would be incurred in order to produce the desired effect of pregnancy termination would seemingly not warrant the ingestion of the medicine to begin with. And I think that's a theme that we can that still rings true to this day of many of these toxins that, if taken in enough quantities to induce abortion, cause severe systemic toxicity. This is another example of that. Quinine became used. Quinine used to be available over the counter or prescribed for various afflictions, including afflictions of the nerves. And it was not uncommon to ingest quinine and attempt a termination of pregnancy, as well as other chemicals like Clorox bleach or turpentine ingestions. This one study, actually described from the 80s, but it could have been written from longer ago, described a series of patients presenting with synchonism, nausea, vomiting, tinnitus, and some with more severe outcomes with no deaths in this series from using quinine. And I would like to end just by describing three kind of historic cases. I've left them all as kind of unknowns initially, so as I go through them, you could sort of think and see if in your head what you think these might be. This is the first case of a 34-year-old malliparous female with multiple living children, incidentally. She'd had several miscarriages, including one rather recently, so on October 7th, and then several weeks afterwards, she presented with severe symptoms. Since her last miscarriage, she had been seemingly ill. She had been vomiting, a severe headache, and then several days prior to presentation had just a slight fit. And then the night prior, she had 4 severe fits, so assuming convulsive seizures. And since then has been in a stuporous condition in which she was not able to be roused. She was restless, tossing about. She was noted to have extreme anemia, a sweet metallic odor on her breath, and a marked blue line on the gums. They tried to look for papilledema, but were not able to because she was too restless, and she died in convulsions the following day without ever regaining consciousness. So this is a case of severe lead encephalopathy and plumbism from its use as an abortifacient. It's a fatal case. Next case, it was someone a little bit later, a 24-year-old, was admitted to a ward with concern for a drug reaction because she presented with sort of nausea and vomiting and a sort of undisclosed rash. She was noted to have vaginal bleeding and then disclosed to the ward sister that she had taken a substance to try to terminate a 3-month pregnancy. Initially, she had a low-grade fever, appeared well nourished, she was tachycardic and tachypnic. She complained also of nausea and vomiting, abdominal pain, and diarrhea. She was previously healthy. She had 2 healthy children at home. And then in terms of the course of her illness, she basically went into renal failure, passing 2 ounces of urine that evening, but no more until her death. She continued to vomit throughout the days. She had a very elevated BUN that only continued to rise. She had severe anemia with hemolytic characteristics. She developed liver hepatomegaly with new liver enlargement. And then she suddenly became stuporous and developed epistaxis, had aspiration pneumonia, and basically died with a really elevated BUN of 646. So their summary of this case was that she had hemolytic anemia, acute tubular necrosis with death from uremia, and on autopsy noted cloudy centrolobular swelling of the liver. So this is a case of pennyroyal poisoning. Pennyroyal typically described as causing a severe hepatotoxicity, in this case with severe renal impairment and ATN and hemolytic anemia as a complicating factor. And then the last case I'll talk about is a 21-year-old woman, again, mother of 2 children. And I will say that it's interesting, many of the cases that were described were not of single unmarried women. Many were women with other children who were usually often described as being married and very young. This patient was presented unconscious to a specialty hospital. She had been previously well the night before when the husband returned home to find her unconscious, face down in the floor. And later on, he commented that there was some emesis and some black pills were noted in the emesis. On presentation to the hospital, she was unconscious with leftward deviated eyes. Her upper limbs were hypertonic and held in flexion, and her lower limbs were flaccid with absent reflexes. 24 hours later, she was still unconscious, but was now moaning and restless. She had twitching of her upper limbs, which were again hypertonic and held flexed and abducted. And then she had flaccid paralysis, the lower limbs. She had a spinal level that was documented in terms of her response to painful stimuli. That level rose over the next couple days, and she died 84 hours after she'd been found without ever regaining consciousness. So this is sort of an unusual case. This is the apiol that I had mentioned, the parsley extract that was sometimes combined with ergot, although not documented to be so in this case. And one of the things that was so interesting learning about this is that the thought after multiple cases and several case series and pretty extensive investigation during the time, this apiol was widely found to be contaminated with triethylcressyl phosphate, which you'll remember is the same compound that caused sort of the Jamaica ginger paralysis or ginger Jake, in which this organophosphate compound was used kind of probably unintentionally as a substitute during the time of prohibition for alcohol, and had numerous hundreds and hundreds of afflicted patients in the 20s and 30s, and many of whom developed sort of initially ascending neuronitis, where they developed paresthesias and weakness in lower extremities and upper extremities, some of whom had permanent issues. This case describes really an acute encephalopathy, which was described with triethylcressyl phosphate a few other times. But I thought that was really fascinating that there was another outbreak that has sort of went under the radar that was not described historically a bit because of its use as an abortifacient. And I think this topic is relevant today because as the current political climate with multiple attempts at criminalizing medical abortions, people are turning to other methods. And this is published a couple years ago now in Rolling Stone, but there is a huge surge in interest in quote unquote herbal abortions, where very uninformed folks are posting things online about how to end pregnancies if you are in a place that has newly difficult access to abortions. At the time of publication of this, the hashtag of pennyroyal tea on TikTok had 1.1 million views, and a mugwort had 157 million views before they were taken down. And so there's a lot of interest in the use of these things, and with people who probably shouldn't be qualified to give medical advice. And sort of my concluding comment is just kind of similar to the physician's commentary, over 100 years ago with the use of lead as abortifacients, is that in order to potentially even induce a terminated pregnancy with some of these remedies, there is a huge risk of severe systemic toxicity, as we've learned from decades, if not centuries, of historical use. It's a stark contrast to the safety profile of what is currently medically available. Oh, and one other thing I forgot to mention of this, right, is if you have medicines that people are using that are not regulated, then unregulated things get in there, and it might be that the harm is coming from an adulterant and not from the substance itself. And I think that's something to keep in mind. And I think with that, I will end it. Thank you so much.